Hey guys, welcome to my channel. Well, welcome or welcome back to my channel. My name is Kendra, aka Miss K. I've been the medical assistant since 2004 and the medical assistant instructor since 2011. In this video, I am going to be going over some common interview questions. Now, of course, there's no way I can go over everything, and there's no way I could possibly know every single thing that they'll ask you. But these are some of the common questions that you may get in an interview for medical assistant. And feel free to leave any down below that I leave off. And first of all, I want to apologize in advance. There's a storm going on outside. Hopefully you can't hear it. I think this microphone is pretty good. It won't pick up much of the storm, but I do want to apologize in advance if you do hear any of it. And I am praying that my power does not cut off. It turned off for a second earlier, so I'm hoping that it doesn't happen again. You may see me looking away to the side because I have some notes up here. I don't want to forget anything, so just forgive me if you see me looking back and forth, okay? But the first question that I want to go over, you guys have probably heard me say this over and over if you watched any of my previous videos on interviews, but one of the first things that they're going to ask you is tell me about yourself. Matter of fact, this is probably going to be the first thing that they ask you, and this is where a lot of people mess up because a lot of times this is where people will give either too much information or not enough information. And then sometimes people will get personal right here. Now, this is not the time to get into your family life or any of that. They want to know about you professionally. So this is where you'll say, if you are brand new to medical assistant, you just finished school, you may say something like, I recently completed my medical assistant program where I learned both clinical and administrative skills. Some of the clinical skills I learned was phlebotomy, EKG, vital signs. Some of the administrative skills that I learned was patient scheduling. I learned a little bit of billing. So this is where you want to just talk about what you learned in school, okay? And also, if you did very well in school, I always tell my students, especially my honor roll students, you want to really talk about that because you don't have any experience. So sometimes you may want to even mention I was 3.5 GPA or 4.0 GPA. I often helped my instructors with other students with whatever you can share that you did in school that was like a very big thing, like a big accomplishment that you had in school. I graduated at the top of my class. Whatever that is for you, you want to also share that. Now, if you're somebody who had experience, you may say, I previously worked in a clinical setting in the GYN office or cardiology, wherever you work. In that office, I was doing EKGs. I was responsible for placing the Holter monitors and event monitors if you were in cardiology. Or I worked in a GYN office and I assisted the physician with procedures, whatever you did, you want to just hone in on those things. And also you may even mention how passionate you are about healthcare. I'm very passionate about patient care. I'm very dependable. I'm excited to grow in a medical office setting where I can support both the patients and the team. So, this is the time again to talk about yourself professionally, nothing personal. You want to always keep that intro short, professional, and connected to the job. Now, the next question you may get, and of course, this isn't in any order. Although I do believe "Tell me about yourself" will be first. Most of the time, it's first. Another question they may ask is, "Why do you want to work for our company?" Now, where a lot of people go wrong is, they don't do any research about the company. I always say, do some research about the company before you go. You should already know why you want to work there anyway. So this isn't something that should catch you by surprise. I know some people, I know there are a lot of people out there looking for a job and you just want, anything, something right now. But I do want you to also know what you're getting into because they may have some practices that you may not necessarily agree with. They may, require some things of you that, that you just can't give, right? And so I always recommend you want to know, I always recommend people to look up the company, make sure you're able to answer that question. You never want to say because I need a job or because it's close to my house or because I heard you were hiring, even if those things may be true, right? It's like, actually we had an interview one time in my former position when I was lead MA, and we were interviewing a young lady and she literally came out and said, she said, I'm gonna be honest. She said, I don't know anything about your company. She said, I was looking at medical assistant positions and I noticed that this was close to my job. I'm sorry, close to my house. Now, me personally, that didn't bother me too much because I appreciated her honesty. I'll be honest, I appreciated her honesty. However, that maybe can rub some hiring managers the wrong way. So I wouldn't necessarily say that. But I would look at their, look on their website, find out what their mission is, their patient population, also the type of services they provide, and then talk about that. Because you may even say, I want to work for your company because I love the type of services you provide. I love that you guys are doing cancer research, specifically if maybe you're working at a hospital that does a lot of cancer research. Maybe you're even working at maybe a teaching company where they hire a lot of, residents. I love that you guys are, a teaching hospital or teaching facility because I want to work my way up to nursing. I love that you guys are affiliated with this hospital or this program or whatever it is that you notice about the company that you like. You want to make sure you mention that. You may even say something like, I see that your company values patient care, and that is the type of company I want to be a part of. And then if it's a specific specialty, you can always point out why you want to work in that specialty. Like again, if it's cardiology or GYN, you can talk about why you want to work in cardiology, right? Many of you have chimed in the comments on some of my videos and said, I really want to work in GYN, or I really want to work in pediatrics, whatever it is, family care, family practice. You want to just point out those things, and this is specific to you. So whatever it is about that specialty that attracts you, that is your moment to share that. And then again, if it's a teaching facility or teaching hospital or, a teaching company, you can say something like, I want to work somewhere where I'm not only using my medical assistant training, but I'm also continuing to learn. The key to doing well with answering this question is to keep your answer about the company, the patients, the team, and also your growth. All right, next question. What are your strengths? So they may say, what are your strengths? Or they may come on and say, what are 3 strengths? Name 3 of your strengths. So whatever the case, this is something you want to, already have in your mind. And you want to pick strengths that are connected to being a good MA, right? Like good communication skills, organization, dependability, being teachable, right? Your attention to detail, and especially staying calm under pressure. That is definitely something they're going to be looking for, someone who can stay calm under pressure. So you may say something like, one of my strengths is that I'm very teachable, and I understand that every office has its own workflow, but I'm willing to learn how the provider and the team prefers things to be done, especially if you already have experience, because you want them to know that you are teachable and you're willing to learn how they do things. Like for an example, I've been in this field over 20 years now, but if I could work at a new company, although I have experience, I still need to learn how to do things their way, right? So I would need to let them know, like, although I have this experience, I'm very teachable and I'm excited to learn how you guys do things here. Now, being able to name specific strengths, this is a lot better than just saying, I'm a hard worker. You don't want to just say, I'm a hard worker. Even if you are, it's just very broad. You want to just be very specific. And again, keep it connected to being an MA. Now, the next question is, what is your weakness? And they may even say, what are 3 weaknesses? Now, this is difficult for some people because, some people have a hard time, knowing what they should share, right? And the thing is, you don't want to share anything that sounds unsafe or unprofessional. You don't want to say, I'm always late. You don't want to say, I'm not a people person. I don't like people. I'm impatient, right? You don't want to share anything like that. You may share something like, one area I'm still working on is building more confidence as a new MA, which is true, because as a new MA, you will have to work on your confidence, right? I've noticed that about a lot of students. They're nervous, rightfully so. You're going into a new field, so you want to just be honest about that. I am nervous about, starting this new position. I'm just entering the field. This is my first time working as an MA. So honestly, I do need to work on being a little bit more confident and sure of myself and not second guessing myself. You may say something like that. And I always say too, sometimes your weakness is even your strength. So I'll give you an example. So for an example, this is true for me. One of my strengths is that I am very empathetic, right? I am able to relate to my patients. My patients love me. I've always had good relationships with my patients because I'm always smiling. I'm always taking good care of them, right? So that is a strength of mine. However, it is also a weakness because sometimes I take things home with me. Like I could be at home and I'm thinking of, a certain type of case that I seen that day. So that's also a weakness. So although it's a strength being empathetic, one of the things I need to work on is not taking my work home with me, and not being so empathetic that it is affecting me personally. And if you do share that you are working on being a little bit more confident, you don't want to just leave it there. You do want to also let them know, I am working on confidence, but I know with repetition and experience, I will get better. I will become more confident. So you do want to assure them that you are working on it, and that you're confident that you're gonna get it. Question 5. Now, this is something that I'm almost certain that they're going to ask you, and this is, how do you handle difficult patients, or how would you handle difficult patients? Now, this is, it's a big one, because this is a matter of when, not if, it's going to happen. And you want to just assure them that you will stay calm. You will assure them also that you will listen intently to the patient. And then you want to also let them know that you understand that some patients are just, not feeling well. You're not going to take it personally. You want to also let them know that you're going to follow the proper chains of command. So whether that is, if things escalate, needing to get the office manager, or the we're maybe starting at the clinical manager, and then it has to escalate to the nurse, to the office manager, and then security or whatever. You want to just make sure you let them know, first of all, that you're not going to match that energy. You want to make sure that they know that you're not going to get frustrated with the patient. You're not going to raise your voice. You're going to let them speak. You're going to show empathy, right? And let them know that you're going to do your best that you can within your scope to help them. Next question, how do you handle stress in a busy clinic? Now, this is a question, or maybe they may say, how will you handle stress in a busy clinic? They may even ask you, how, because especially if you're new, they may want to know, how have you been able to just handle stress in general? Maybe you are someone who came from retail, like how are you able to handle stress, working with customers, or, whatever, they may want to know how you were able to handle the busyness. And you may say, I handle stress by staying organized and prioritizing what needs to be done first. You may also say something like, I know that it's important to stay calm. You also may say something like, I know it's important not to panic. I will focus on patient safety, urgent tasks, and making sure I keep the provider and team updated if I need help or if I'm running behind. The key to answering this well is just showing maturity. The next question you may get is, what clinical skills are you comfortable with, or what clinical skills have you performed? Now, be honest. Don't claim to have done something you have not done. So just focus on your strong areas when answering this question. If it's vital signs, EKG, phlebotomy, injections, whatever they are, this is your time to speak on those clinical skills that you have done and you feel really comfortable with. Now, if they ask you what clinical skills, that you struggle with, you can also be honest about that, but then also, again, reiterate to them that you will do what it takes. You understand that once you've been doing it for a while, get more experience, you are confident that you will become stronger when it comes to that skill. And I will say this, an employer will respect honesty before they will respect fake confidence. So don't act like you're confident in something that you're not. It's okay to be honest. Okay, another question you may get. So what do you do if you make a mistake? Or what would you do if you made a mistake? Or maybe even ask, what have you done when you've made a mistake in the past? So if they ask you, what would you do if you make a mistake? You want to show accountability, of course. You may say something like, if I made a mistake, I report it right away to the appropriate person, whether it's the provider, the nurse, or supervisor. I will be honest about what happened, follow the office policy, and learn from it so it doesn't happen again. Lawyers want to hear you take accountability, and then they also want to hear that you are going to do your best to not allow it to happen again. And they also want to know that you learn from it. Question 9, how do you protect patient confidentiality or patient privacy? And this is where, of course, HIPAA comes in. Now, you may say something like, I protect patient confidentiality or patient privacy by only discussing patient information with the appropriate members of the healthcare team, not talking about patients in public areas, logging out of the computer when I step away, and making sure documents or records are handled properly. I understand that patient privacy is very important and that HIPAA must be followed at all times. You want to keep that answer clear and professional. Now, question 10, why should we hire you? Why should we hire you? What makes you an asset to this company? Now, this is your chance to close strong. This is not your time to be shy. And of course, now I was going to mention something there, but I'm going to actually mention it after I give this last one. But for this one, you may say something like, and of course, this is going to be specific to you. I'm just giving you guys just some notes that I jotted down, just some things for you, but this is going to be specific to you, okay? So you may say something like, you should hire me because I'm dependable, teachable, and I'm serious about growing as a medical assistant. I understand this role requires professionalism, compassion, attention to detail, and teamwork. And I may still be growing in some areas, but I'm willing to learn. I'm willing to take correction or constructive, criticism. And I'm going to show up every day ready to support the patients, the provider, and the office every single day, right? This is your time to really up yourself, okay? Now, that's something that you may say as a new MA. If you're someone who has experience, you may say, you should hire me because I bring hands-on medical assistant experience, strong patient care skills, and the ability to support both clinical and administrative needs. You want to really make sure they know that you have both clinical and administrative skills. Understand the flow of a medical office. I work well with a team, and I take pride in creating a professional and positive patient experience. Now, I'm giving you guys my answer. But of course, this is going to be specific to you, but that is definitely something that I say in interviews. So that was question 10. Now, let me see. I did put in here like some questions that they may ask you. They may ask you if you have any questions for us. Never say you don't have any questions for them. Always have some questions. And these are things you can kind of have in advance. Okay. So if you don't know what to ask, already have these in mind. Okay. What does a typical day look like for a medical assistant? I always ask that. Okay. These are questions that I already have ready. Sometimes they answer it because you have some employees that will tell you literally everything about the company, what they expect of you and all of that. But just in case they didn't explain it, have these questions ready. But again, what does a typical day look like for the medical office? How many providers would I be supporting? I always ask that. Would I be with just one provider or would I be with a different provider? Every day, am I expected to float to different clinics? This is especially important for companies who have multiple locations. What are the main clinical and administrative duties for this position? You want to get an idea of what you will be doing on a daily basis. Also, what qualities do you look for in an MA on this team? Like, what is your ideal candidate? And then also you can ask about, training for new hires, like what would training look like? That's something I always ask as well. So this is pretty much it, guys. And when it comes to having questions to ask, it helps you to look prepared, and it helps you. It lets them know that you're really interested. As I mentioned earlier, you never want to say like you want to work for the company just because you want a job. If you go in there and they say you have any questions and you say no, you're going to seem uninterested. You always want to have something to ask. Okay. All right. So I'm going to put a link in the chat. Actually, this is not a live video. The link will be in the description. Guys, I'm so used to being live and leaving links in the chat. Actually, the link will be in the description of this video. So for anybody who maybe needs a template for resumes or cover letters, or even a thank you letter template, thank you email template, I have that. References template, I have that. It'll be linked in the description, and I'll also link it in the comment section. Okay. And just a final word on this, guys, make sure you do some research. Do some research again on the company, on the specialty that you may be working with. Also, make sure you're practicing your answers out loud. So it's one thing to know how you want to answer it. It's another thing to actually say it out loud. So I recommend, if you have somebody that can even practice with you to so that way you can actually say it to someone and tell that person to be serious. You don't want somebody that's going to practice with you that's going to be laughing and joking. You want somebody that's going to be serious, either your instructor or maybe even a career services department at your school, your spouse, a kid, a grown child, or somebody that's not going to play. Put it like that. Somebody that's not going to make a joke of it, but somebody that's going to be serious and really hold you accountable. You may even practice by yourself in the mirror, but you guys want to become, just comfortable and confident in your answers, because I always say confidence makes a big difference, guy. Makes a big difference in how you present in interviews. And trust me, most employers know that you're going to be nervous, especially if you're a brand new MA. Even experienced MAs, can be nervous going into an interview with a new company. So they're going to expect that. But I just want you guys to just practice being confident, knowing who you are. Again, if you got to practice in the mirror, if you got to record yourself saying it and then listen back to it, whatever it takes, just get your practice in. Again, I mentioned it earlier, just be honest about your skill level. Don't go in there and act fake confident. Employers, they want somebody who is teachable, okay? They would rather have someone who maybe need a little bit more work on certain skills, but then they're teachable, versus somebody they can be excellent in their skills, but they're not teachable, they're know-it-all, right? They don't take accountability. So just remember that it's okay. You don't have to be perfect. Honesty is key. More than anything, they want somebody who is professional, safe, teachable, and dependable. Okay. All right. So if you have an interview coming up, I hope that this was helpful. Let me know in the comments which one was most helpful to you, which one, if any, stood out to you. Also, if I left anything out, which I'm sure I did, there's so many possible questions that could be asked in the interview. Feel free to leave those down below, especially those of you that are experienced. Come on. This is the time for my experienced MAs. Come on, seasoned MAs. I need you guys to chime in and put some questions in the chat that you have received. And again, my resource, my resume starter kit is going to be linked. I have a resume template in there, a cover letter template. And if you guys use these templates, please make it your own. Do not commit plagiarism and copy and paste this resume or this cover letter template. There's a guide in there that tells you how to use them. So just please make it your own, okay? And then also, again, there's a thank you letter, thank you email template in there, and then also a references template, okay? Let me see, am I forgetting anything? I think this is everything. I hope I do not end this video and then I realize something is missing. Oh my goodness, I did not mean for this video to be that long. Anyway, guys, thank you for visiting my channel. Make sure you like the video if you enjoyed it. If you are not already subscribed, what are you waiting for? Go ahead and subscribe. Thank you guys for visiting my channel. Be blessed.